are at a time in medicine when physicians are being asked to do more things with more toys for more people. We have more gizmos, gadgets, technology, and things that go bump, beep, swish in the morning, afternoon, and night. These range from the lightest laptop to the sleekest CAT scanner to the quietest MRI. It brings to mind a scene from Monty Python's movie, The Meaning of Life. Part 1, titled The Miracle of Birth, starts with a woman laboring quietly as the doctors and nurses stand at her bedside. It is apparent that the doctors are ignoring the patient and seem more focused on using the hospital's most expensive equipment to impress the hospital administrator. The following conversation ensues. Doctor, so it's a bit barren here today, isn't it? More apparatus, please, nurse. The EEG, the BP monitor, the ABV, and get that machine that goes ping. And get the most expensive machines in case the administrator comes. That's it. Bring in the other machines, right over here. Patient, what's that for? Doctor, that's the machine that goes ping, and that's the most expensive machine in the whole hospital. It cost over £750,000. Aren't you lucky? Nurse, the administrator's here, doctor. Doctor, quick, switch everything on. Administrator, oh, very impressive, very impressive. And what are you doing this morning? Doctor, it's a birth. Administrator, what sort of thing is that? Doctor, well, that's when we take a new baby out of a lady's tummy. Administrator, wonderful what we can do nowadays. I see you have the machine that goes ping. This is my favorite. You see, we leased this back from the company when we sold it to them, and that way it comes out of the monthly current budget and not the capital account. We try to do our best. Well, do carry on. This movie was released in 1983. As a recent resident graduate, I remember thinking how funny, exaggerated, and silly this scene seemed. As a wide-eyed and naive physician, I thought how absurd that a doctor would think impressing the administrator and playing with machines was more important than taking care of patients. Perhaps John Cleese and his fellow Monty Python cast were clairvoyant. 30 years later, I see this scene and sadly think this is a realistic depiction of how some physicians, administrators, and the public define quality care. There is a sentiment across several industries, including healthcare, that newer, bigger, and more expensive is better. This is evident in the marketing campaigns of healthcare systems, which often use the latest, greatest, biggest, fastest fandangle contraption available to bait patients. The seduction of technology, including computers and diagnostic instruments, may be its ability to lull one into thinking it compensates for deficits in performing histories and physical exams. Another appeal of technology is that it's perceived as more time efficient. Electronic medical record programs are replete with symptom-driven templates containing checklists for documentation. It's like a GPS program providing only the directions with the fastest route and no options for scenic tours or points of interest. They are seen as efficient, i.e. the fastest way to interview a patient. These templates contain initial questions which could be asked. Unfortunately, some providers feel that if they complete the list, they have done a thorough job. However, one of the limitations of templates is they do not provide a script for what the next question should be based on the patient's responses. This is one area where the art of medicine can have a significant positive impact. It is challenging in an environment where the latest technology is glorified and embraced to sell residents on the virtues of what they may consider an archaic approach, which requires time to both learn and to use. It is an instrument which requires no batteries or electric power source. It has no bells, no whistles, and no lights. It's known as intellectual curiosity. Intellectual curiosity is defined as the desire to learn about something just for the sake of knowing it. What residents know may not be as important as what they would like to know. We should foster in residents a desire to know their patients, not just their diseases, medications, and most recent lab results. The family physician has a vantage point of recognizing, defining, and appreciating how knowing their patients can positively impact their patient's health. The family physician shows they are receptive to relating to their patient on a personal level by being curious enough to pick up the threads the patient lays down when answering questions and using it to weave and spin their story. This ability defines the uniqueness of the patient-family-physician relationship. A physician on the quest for a diagnosis may use an approach with questions intended to define the patient in terms of symptoms and physical findings. This may suffice for some providers and patients. However, the family physician, who seeks the correct diagnosis, approaches each encounter using intellectual curiosity to ask the right questions. It has been debated whether intellectual curiosity is a learned behavior or not. It can be found inherently in each of us. Just look at the universal phenomenon of 3-year-olds who are constantly asking why. This inquisitiveness is often suppressed as one gets older. It needs to be resurrected. Teachers of family medicine should help residents tap into their inner child by encouraging them to deviate from templates when appropriate. Residents should learn how to practice and master the use of intellectual curiosity. In addition to having this role modeled for them, residents can identify areas of interest and explore them further. For example, a resident might enjoy listening to the Arctic Monkeys. Their song, "Do I Want to Know?" is playing on the radio. The resident may already know the names of the band members, which instrument each plays, and where the next stop on their concert tour is. As he sings along with the song, a resident might think, when was this song written? What do the lyrics mean? How did this band get together? He then proceeds to research the answers to these questions. He's demonstrating intellectual curiosity. He does not need to know the answers because he'll be tested on it the next day. The point is, he wants to know the answers for the sake of learning, not because he has to know. His ability to take his curiosity and satisfy it will enhance his future listening experience. The next step is to have the resident pose questions to a patient that will increase their understanding of the patient. For example, a resident is asked to see a patient presenting for a physical. The patient is a 58-year-old female and she requests an Adacel shot. The resident may choose to ask the standard questions, perform the exam, and give an order to the nurse to administer the shot. The resident using intellectual curiosity may ask, "Why are you asking for an Adacel shot?" This one question leads to the patient explaining that she's flying to Florida in 3 weeks to see her 4-month-old granddaughter for the first time. She further explains that she read about the increased risk of whooping cough in young children from non-immunized adults. She wants to be up to date when she sees her. She relates how excited she is because she is a widow and her only child, a son, lives in Florida. She has never been there before because of her fear of flying. This one question, which sprung from the resident's interest in knowing more about his patient, provided a wealth of information which otherwise would have been missed. Does this extra information change the management of the patient during this visit? Probably not. Could it enhance his future patient experience because he set a stronger foundation for a patient-physician relationship? You betcha. Family physicians are uniquely poised to relate on both a professional and personal level with their patients. The series of personal interactions occurring within each therapeutic relationship are the heart of what we as family physicians do and can do best. We need to teach those joining the ranks of family medicine how to appropriately utilize and maximize all the resources at their disposal. In doing this, they need to appreciate that technology does have its place in evaluating patients. Residents need to learn how intellectual curiosity can be the most powerful tool in their armamentarium for helping patients get and stay healthy. I believe that we as teachers of family medicine have a responsibility to redirect resident attention back to the value of knowing their patients as human beings. Residents who embrace intellectual curiosity exude an enthusiasm which is contagious. This enthusiasm fuels teachers to keep on teaching and lets them reap the reward of educating physicians who both care for patients and are patient-caring physicians. Thank you.